Well, thank you all for being here, and I know we've done this coffee with Susan for many years, and we always appreciate her hosting and see many familiar faces and some new faces, so that's great. And Susan, remind me, do we have until 10, or do you need any time? 9:30.
We can go a little bit longer, but 9:30 is what we...
Okay, yep, okay. I just want to be sure I stay on track and don't cut Daniel off too much like I usually do. So for those of you who aren't familiar, the Children's Defense Fund is a nonpartisan, nonprofit organization. We were founded by Marian Wright Edelman, a well-known civil rights activist who turned her attention to children's issues and founded the Children's Defense Fund just over 40 years ago. She's still our president and CEO in our national office out in DC. And Minnesota is one of about 10 or so state and regional offices of the Children's Defense Fund. And we work on a lot of the same issues as the national office, but definitely are able to focus on the needs of Minnesota children and families. And our mission is up there. It's long, it's a bunch of starts, but basically we want to ensure that children have a successful childhood so that they're able to enter adulthood and be successful. And we know that's beneficial not only for the individual child and their family, but for our community as a whole when children are successful. And in Minnesota, we do our work in kind of 4 areas. So first and foremost, we're a legislative advocacy organization. And in fact, we're the only legislative advocacy organization in the state to focus solely on the needs of children in Minnesota. And we were founded about 30 years ago. We just had our 30th birthday party. And really the main issue we were focused on when we were founded was access to health care for children. So we were instrumental in the creation of Minnesota Care and the expansion of public health care programs in Minnesota. But now we're doing a lot better in providing access to health care in our state, particularly for children. Still work to be done, but we've kind of changed our focus to be on economic stability for Minnesota families. We know when children live in economically stable households, they're more likely to have access to opportunities that help them thrive. And so our executive director was the co-chair of the minimum wage campaign that was successful in raising the minimum wage. We made that a children's issue, as you know it is. And then we also are working on policies now around access to childcare, affordable childcare, as well as paid family leave. And then we do a lot around access to early education and really all kind of a variety of issues of child well-being. And we'll talk a little bit, Daniel will talk specifically about this year's legislative priorities. And then we do research and education, of course. So that's primarily our Kids Count project, which is funded by the Annie Casey Foundation, a nonprofit based out in Baltimore, and they give a Kids Count grant to one organization in each state to track data on child well-being. And so we've been that grantee for 15 years or so in Minnesota, so we've done this for a long time, and the Kids Count data is put online into an annual data book, and then we also, of course, present across the state on the data and serve as a resource to organizations and service providers to understand how children are doing in our state to influence policy and programs that improve their outcomes. And then the closest we get to direct service is through our outreach initiatives. The one that is most well known is our Bridge to Benefits project, which was started in 2007, and it's a web-based screening tool for families to figure out their eligibility for work support programs and tax credits like SNAP and WIC, the school meal program, Childcare Assistance, etc. So it's a quick screen, takes about 5 minutes to complete, gives families what they might be eligible for, links them to the application, as well as to someone who can help them apply, who will follow up with the family and walk them through that application process. So our model has been to do that work through organizations. So we have nearly 400 organizations who are trained to use Bridge to Benefits in our state. And actually, I think our top user is SEEP. And so they use Bridge to Benefits to screen their clients. And so I do have information about the project. We do free trainings and provide resources to use the web tool. So if your organizations or schools, I know we do train a lot of schools on using the tool with their families. And then we did have a school breakfast initiative to increase access to the school breakfast program. That has since ended, but we were successful in giving some grants to schools to improve their school breakfast service. And then we do youth leadership. We have freedom schools, which are summer and after school literacy programs. In fact, I think a couple years ago we started some freedom schools in Osseo. I know one is at Birch Grove in the summer, but most of the other freedom schools are in the Minneapolis and St. Paul area, and they're a culturally relevant curriculum. We have a curriculum for African American or Black children, Hispanic or Latino children, and American Indian children, and with kind of the goal for them to fall in love with learning and reading and get some mentorship with people who look like them and are from their communities. So it's been a really successful model in, I think it's about 30 states now, but the curriculum was created by the Children's Defense Fund. And then we do some leadership training for young adults to advocate for children. And then we have an annual event called Beat the Odds, where we honor 5 young adults who've overcome tremendous obstacles and to be successful in school and life. And this year our event will be on April 9th, at the McNamara Alumni Center at the University of Minnesota. We have some save the dates. We'd love to have you join us. It's a great event to hear more about young people in your community. And before I go on, for people who just came in, feel free to grab materials and coffee and treats. I'm really informal, so get up, ask questions as I present. And maybe if we could just hear who the people who just walked in are, if you're with an organization.
Yeah, sorry, my name is Michaela Alden with Plymouth and Robbinsdale Schools.
Gretchen Dellinger from Osseo, Early Childhood.
Great. I think you're the other one.
Sorry.
No.
Kendra Coleman, Early Childhood, Osseo.
Okay, great. Yeah, more than
Who are you?
me. Yeah.
You're just introducing people that just came.
My name is Lauren Hoggle, and I work with the Robbinsdale School District, the early education programs doing community outreach.
Great. Thanks for being here. And I just said grab materials and treats. And so all the data today that I'll be sharing, or most of the data, is available online on our Kids Count data center at datacenter.kidscount.org. It's a really neat tool. It's easy to use. You can access data at the national, state, county level. There's some city data, mostly Minneapolis. And it has more than 200 indicators. A lot of them are disaggregated by race and ethnicity or socioeconomic status. You can create maps and trend lines. A lot of organizations use it for reports, for their funding. And so feel free to go on the tool. It's pretty easy to use, but also you can always contact me for any data needs. We do take requests. Yeah.
Someone just came in to introduce yourself.
Oh, yeah, if you don't mind.
I'm sorry, I was having another meeting. I'm Kathy Hempkin, the mayor of the Wolf.
Thanks for coming. And we're grabbing some materials for you here. And so this year's data book, we always kind of choose a theme and share the data around that theme. And for this year's data book, we really wanted to focus on developing opportunities for all Minnesota children, particularly children of color and American Indian children in our state. So we know that Minnesota is a great state for families and children to live in when we look at the data, but many families don't benefit from some of the opportunities that our state provides. And so we want to make sure that we draw attention to not just the disparities, but the opportunities that we have to invest in all children. So, and the Children's Defense Fund is really committed to being a leader in the conversation around race equity and in the advocacy work on that as well. So we really wanted to focus the data book on those opportunities for all Minnesota children. And so how it's kind of laid out is there's an introduction section that talks about kind of environmental factors that affect child well-being and how children of color and American Indian children in our state are oftentimes disproportionately affected by those environmental risk factors. And we also talk about the demographics of Minnesota and the changing demographics that really show the importance of investing now in all children and making sure that they're successful, because the face of our children is changing in Minnesota. And then we have sections of the data book that are arranged by children's developmental stages. So we have prenatal to birth, early childhood, school age, adolescence. And so usually most of our data is for we define child as someone 17 years old or younger. So that's what most of our data talks about. But we really wanted to go beyond that in this data book and highlight some of the issues young adults are facing particularly since the recession. Young adults are still really affected by the recession and are having trouble launching into career after college or high school. And so some of that data shows that. So in each of those sections, we talk a little bit about that developmental stage, and then we have about 4 or 5 data. Really, they're mostly infographics or graphs that show some of the data around this developmental stage that predict child success later on in life. So we chose those indicators not just as indicators of like how children are doing in early childhood, but we know, access to early education is going to predict their success later in life. So that was one of the indicators we chose. And then all those indicators are broken down by race and ethnicity, so we can kind of see how we're doing for different communities of children. And then at the bottom of each section, we highlight 4 kind of programs or policies that are already existing and improving outcomes for children, particularly children of color and American Indian children in our state. So we really wanted to show that Minnesota knows what works. We already have programs and policies in place that are improving outcomes for children, but we need to make sure that those programs and policies are accessible to all children, they're targeted investments, and that they're culturally relevant and appropriate. And then at the end of the data book, we have our state level data that we always publish in the data book. So there's about 100 or so indicators back there. That's aggregate data, or it's not broken down by race and ethnicity. It applies to all children. And in the left column of that data, you'll see in some spots it'll say CT, and that's where we have county level data available. And then of course we do create county fact sheets each year. I brought kind of the 3 big metro area county fact sheets here, Hennepin, Ramsey, and Dakota, or Washington. But we have all 87 county fact sheets on our website as well if you're interested. And that's just a snapshot of the county data that we have available, so there's even more. So just to kind of lay the foundation, and I think we can all probably agree on this, what kind of children need to be successful in childhood. It starts, of course, with basic needs: food, clothing, housing, shelter, childcare, transportation, and things like other necessities like toilet paper and things to be able to have a clean house. So once those basic needs are met, that's not all that children need, of course. They need opportunities to learn, grow, and explore, and really for them to thrive. And so that starts with prenatal care. In early childhood, caring and responsive caregivers is very critical because there's so much dependency, and that serve and return relationship with a child is so important in early childhood, but really throughout a child's life, they need caring and responsive adults. And then we want them to have safe and supportive communities, access to high quality early education. We know the academic benefits, but also, a lot of the research shows the improved health outcomes, the ability to regulate emotions when you receive high quality early childhood education. And that's been a hot topic of discussion in our state, how to provide that for all children. And then we want them to enroll in excellent schools and have enriching summer and after school opportunities, and then have the encouragement and support to have college or career success. And really, as I kind of mentioned earlier, Minnesota knows what works for children. We're a state that is proud to be a great state for children and families. And in fact, the National Kids Count Data Book released this summer, we have some copies available here, really touted the fact that Minnesota is a great state for children. In the data book takes 16 indicators of child well-being and ranks states based on those indicators, and Minnesota actually came out ranked #1 in child well-being compared to all other 50 states. And in the last 10 years, we've been in the top 5 the majority of the time, and since the data book has been printed more than 25 years, we've been in the top 10, except for one time we were ranked 11. So we have a history of really investing and supporting children and families in our state, particularly around access to health coverage and care. We've been a leader, We have one of the highest minimum wages in the country now. We've made investments in early childhood education programs. And many of you know, who, especially those of you who work at nonprofits, we have such a strong network of private foundation and corporate support of programs that work with children and families. So we know what works for children. However, the data that showed we were ranked #1 in child well-being is aggregate data. It's not broken down by race and ethnicity. And so when we do break the data down by race and ethnicity, we start to see that for some communities, particularly communities of color and American Indian communities, children aren't seeing the benefit that our state has to offer for children and families. And so that's where we really need to have a laser focus, particularly because our demographics in Minnesota are changing. They're changing rapidly, and the change is being driven by our child population that is growing increasingly diverse. In 2000, we had about 12% people of color in Minnesota. By 2013, we have about 1 in 5 people in Minnesota are people of color or American Indian. And the state demographer's office projects that by 2035, about 1 in 4 Minnesotans will be people of color or American Indian. And actually, the assistant to the state demographer used to be our Kids Count project director. And so I worked with her to kind of look at their projections and talk to her about them. And she said all of the census data over the years and the current census data are surpassing their projections. So it'll be, we're growing more diverse quicker than they even projected. And of course, the child population is already, has more than nearly a third of the child population is populations of color or American Indian. So, and one thing to know about the child population in Minnesota, it's actually stagnating. The total number of children really hasn't grown in more than a decade. The white population, child population has actually declined, whereas populations of color are growing rapidly, which I'll talk about in a minute. So it's, the pie isn't getting bigger, the pieces of the pie are shifting. It's kind of how to think about that. So before kind of going into some of the data that's disaggregated by race and ethnicity, I think it's important to note some of the limitations of data that's disaggregated by race and ethnicity. So most of the data for our Kids Count data book comes from the Census Bureau and state agencies and some federal agencies. And those agencies use 5 racial categories to really kind of define communities. And they're American Indian, Asian, Black, Hispanic or Latino is one category, white, and then people of 2 or more races. And we know those categories aren't really perfect ways to define how people identify themselves. You know, I used to work at Edison High School and helped kids enroll in college. And every time they'd have to fill out a questionnaire that asked them what their race and ethnicity was, there'd always be 1 or 2 of them who would say, Stephanie, how do I answer this question? You know, I'm from Egypt. Am I Black? Am I, you know, what do I, and I'm like, well, it's up to you, but to decide. So these categories are not perfect. They encompass all immigrant populations. So when you think about the Asian population in Minnesota, we have a very wide array of immigrants from different Asian countries and of different Asian descent. So it's not perfect, but it's what we have. And it's important too, Hispanic or Latino is not a race. So Hispanic or Latino people can be of all races. They just speak Spanish or are from a Latin American country. So, and unfortunately, a lot of data is not collected or made accessible that's more stratified and breaks down these populations. And I think that's also important when you particularly think about the American Indian population, because oftentimes there are smaller numbers of American Indians, so data on that population won't be released because of kind of statistical limitations. And so there's a couple times in the data book and what you'll see where we have some asterisks and we put out data that technically we're breaking some statistic rules to put out, but we want to be able to share that data, and we really know, don't want to be constrained always by these limitations, because we need to have something to inform us of what's happening in specific communities. So to dive into some of the demographic data, I'll go over kind of the projections for each population of color in Minnesota. So for American Indian children, there's about 18,000 American Indian children in Minnesota, or 1% of the total child population. And about 3/4 of American Indian children live in greater Minnesota. So that's an important thing to note. But also, a lot of American Indian children and families, they're pretty transient. Sorry, I don't know why that's kind of cut off, but I'll explain what that says over there. But the American Indian population is pretty transient. Oftentimes they're going from reservations in northern Minnesota back to the metro area and back again. So that can be something that social service agencies have to think about. And the American Indian population isn't projected to grow much by 2035, only an 11% increase in the total population, children and adults. And this graph of Minnesota shows counties where American Indian children make up 10% or more of the child population. It's counties with reservations mainly: Mille Lacs, Cass, Beltrami, Mahnomen, Clearwater, a lot of areas in northern Minnesota. And all of these counties are some of the poorest counties in our state. There's about...
Make a comment.
Yeah.
You mentioned Edison High School. That when I said I was a teacher, I taught at Edison. But we used to do, under federal court order, years ago, a site count. And we were told with the Native American population in particular, they were often undercounted. They didn't necessarily have a name that would sound Native American. They didn't always have the characteristics, and yet we were told we could not ask a student what their race or ethnicity was. It was strictly a site count. And so when all that information was released, we were often told that that community in particular was undercounted.
Yep.
I just happened to think of that when you talked about lack of growth within the community, or less than.
Yeah, and that's actually true for the...
Realize is my point.
Yep, that's actually true for the census too. There's been some research on that many populations of color are undercounted for various reasons. One of them being just kind of the fear of being counted and what that means, and historical trauma issues. So
That's
yeah,
true.
it's definitely true.
I was focusing on the fact that it was a site count, which
Is different, yeah.
is a little different than the census, where they're going to have people fill out questionnaires and so on.
Yep.
But anyway, I just thought I'd comment.
Yeah, no, it is true. There's so many limitations and different things that go into the data. So black children in Minnesota make up about 8% of the total child population, or about 103,500 children. And 35% of the growth in the black child population in Minnesota in the past decade, has been attributed to the influx of immigrants, primarily East African immigrants from countries like Somalia, Ethiopia. And by 2035, we're expected to see about a 50% increase in the black population. And the Minnesota graph here shows counties where black children make up 5% or more of the total child population, not surprisingly concentrated in the metro area, but Stearns, Olmsted, and I believe it's Dodge down there are some greater Minnesota counties seeing more and more black families move, and some of them are immigrant families too. The Asian child population in Minnesota has just about under 73,000 children, or 6% of the total child population. Almost 90% of the Asian child population is in the metro area, so a very concentrated. And as I already kind of mentioned, the Asian child and family population in Minnesota is really unique. Most of Asian immigrants in Minnesota are refugee populations, so they're coming from countries that had less access to education. They're coming here with a little less economic stability. than say, you know, immigrants who come to like California and they're coming recruited to work in jobs and that kind of thing. So we actually have one of the highest Asian child poverty rates in the country. And that's been, the Asian child poverty rate has been on the decline, but it is something to think about when you think of our Asian child population. And there's projected to be about a 60% increase in the Asian population by 2035. And again, you'll see the counties where 5% or more of the children are Asian are concentrated in the metro area. However, you see some of the southern Minnesota counties that have more kind of factory jobs, that kind of thing, Nobles, I think it's Stevens County over there, are seeing some growth in the Asian population. For Hispanic or Latino children, you'll see the map is very different. There's about 108,000 Hispanic or Latino children, or 8% of the total child population. And more than a third of Hispanic or Latino children live in greater Minnesota. So that number kind of surprised me. And so already we're seeing kind of the population shift in southern Minnesota, in social service providers, other communities, you know, have had to kind of think of new ways in schools, how to serve and engage families and children in these areas. And the Hispanic or Latino population in Minnesota is projected to double by 2035. And so, yeah, these are counties that make up 10% or more of Hispanic or Latino children make up 10% or more of the child populations. And I think it was Nobles and Watonwan counties have about 40% of children in those counties are Hispanic or Latino. And one thing that's important to note about the growth in populations of color, it's not just due to migration, so that could be immigrants or from other states, but it's also due to populations of color have a higher fertility rate than white populations. So that was included in the demographic report. I'm going to shut this real quick. So as I mentioned, we're having this shift is going to be really important to understand and then adapt kind of how we do business in Minnesota. And we need to target outreach and investment in programs that serve children and families to ensure that they reach children of color and American Indian children. So, you know, a lot of the programs that we already have serve the majority of white children, and that's because we are still majority white state. However, those outreach efforts are targeting the masses, they're targeting white children, they're created and administered by and for white people. And of course, white families have less barriers to access programs, so they oftentimes speak English. You know, when someone's coming into their home, they may be white and that may be safe for them. So I think there's just a lot to think about when we think about how to adapt our programs to better serve all children and families. So some solutions that we know of are to incentivize diverse program participation. So provide incentives for actually targeting populations of color. And I think this is really critical in healthcare outreach and health insurance access. We have a lot of dollars that are going into outreach, and we know that uninsured populations are disproportionately people of color. But you know, MNsure used Paul Bunyan as the face of MNsure, and that's not a face that's identifiable with a lot of communities. So I think it's a lot to think about when we're targeting certain populations. We need to employ people of color to administer and work in programs, create culturally relevant programs with input from communities, and then evaluate how policies at the state and federal level are going to affect communities of color and get them involved in the political process. And we actually have an initiative to do that Daniel will talk about a little bit.
Can you go back to the other slide, please?
Yeah, this one?
Right. I'm just wondering, is that top number accurate for Hispanic Latino?
Yes, it was just a typo.
Okay.
Yep. Sorry, I'm using a different PowerPoint today and I didn't make that change. So sorry about that. And you know, there's of course a moral imperative to ensure all children succeed, but we know that when all children succeed, our state and our economy is going to benefit from that. And so these two figures kind of show that potential. So if U.S. students had met education levels of higher performing nations in the 80s and 90s, our gross domestic product nationally would be $1.3 to $2.3 trillion higher. And in Minnesota, this graph, the red bar shows our current GDP, and then the orange bar shows about a $20 billion growth in our GDP if we were to eliminate racial disparities in income. And so to get to some of the data that's disaggregated by race and ethnicity, we'll start with some of those environmental factors. So this chart shows levels of child poverty by race and ethnicity. So we looked at families at 50% of the poverty level, which is extreme poverty, families at the poverty level, and then at 200%. And so this kind of shows those definitions. Just under $24,000 a year for a family of 4 with 2 children is the poverty level. So we know that the poverty measure is not a measure of economic stability. In fact, we know that families need more than twice that to actually meet just a bare bones budget. But, you know, it's the way that the data is presented. People are familiar with the term poverty. We can track it over time. Half the poverty level is just under $12,000 a year, and then 200% is $47,000 a year. And so when we look at this data, the red bar is for extreme poverty, or 50% of the poverty level. We have 3% of white children, just under 10% of Asian, 2 or more races, or Hispanic or Latino children living in extreme poverty. And we have 1 in 5 Black and American Indian children living in extreme poverty. And of course, poverty has long-term effects on outcomes and development, but extreme poverty really exacerbates those effects. And then the blue bar are families living in poverty. So about 8% of white children in Minnesota live in poverty. About a quarter of Asian, 2 or more races, and Hispanic or Latino children are living in poverty. And then about 40% of Black and American Indian children live in poverty. Overall, we have about 177,000 children in Minnesota living in poverty, or 14%. And that number really spiked by more than 70% from 2007 to 2011 during the recession. And since the recession has since ended, it's only leveled off. And so there hasn't been a significant decline. And in fact, from 2013 to 2014, we saw a slight increase in the number of children in poverty. So we know low-income families have not really seen the benefits of the recovery. We also know that half of the actual gain in children living in poverty was attributed to an increase in Black children. So if you remember when that data was released, there was a lot of media coverage on the decline in Black median income in Minnesota, and it spiked some much needed discussion at the legislature, and so we hope that discussion continues, and we know that data can really fuel that discussion. And so when we look at low-income families, a little bit closer to kind of meeting that bare bones budget, what we think is a better way of measuring economic stability, about a quarter of white children live in low-income families. Just under half of Asian children and children of 2 or more races live in low-income families, 60% of Hispanic or Latino children, and then about 70% of Black and American Indian children live in low-income households, or under about $47,000 a year. And you'll see an asterisk by American Indian. We did have to use 3-year data instead of 1 year. So I'm technically not supposed to put that data on the same slide and compare, but we, again, threw those rules out the window so we could share data with people on all the populations that it's available for. And of course, parental employment affects whether or not a family is able to meet some of those basic needs and be in poverty or not. And what we find is that most parents in Minnesota of all races and ethnicity are working. This is actually full-time regular employment throughout the year. When you break that down by working at any point during the year, it becomes significantly higher. There are some disparities. And what the research really shows about employment disparities is that it's a structural issue. Educational attainment, of course, affects employment opportunities, but what the research shows is that even when a person of color has the same educational or work experiences as a white person, they're less likely to get that call back on their resume. And my husband works in human resources, and he knows several people who have changed their name on their resume, maybe from Ahmed to Adam, and just to get that call back. And so, and what we also know is the data shows Minnesota has one of the worst unemployment disparities in the country, particularly for African American males. And we've actually been called out by the federal government about that, and there's been lots of talk about that recently. And so this graph shows median income compared across race and ethnicity, and you'll see it ranges from in the 30,000s for American Indian and Black families to 84,000 for white families, and it's about 40,000 for Hispanic or Latino, 67,000 for Asian. But what's more important, so there's obviously the disparity here, but when you look at our state rank, you start to see how Minnesota, does well for some families and is kind of in the middle of the pack compared to other states for families of color. So white families, our median income is the 12th highest. Black families, it's the 22nd. Asian families, it's the 31st. American Indian families, it's 14th. However, only about half of the states are ranked for American Indian families due to smaller populations in some states. So you see that that gap in employment and income is wide in Minnesota compared to other states. And when we look at kind of the health and risk factors, what the research shows is that not only are children of color and American Indian children more likely to go without health insurance and access to health coverage, but they're also exposed to environmental health factors at a higher rate. So they're more likely to live in substandard or crowded housing, more likely to be exposed to lead, live in food deserts where there's less access to healthy foods, or food desserts, as I guess I wrote up here. Yes, so I've heard, but I don't really abide by that. And then they're more likely to experience poverty and live in areas of concentrated poverty. So this graph is our children without health insurance. This is 2013 data. We're at about 6% of children are uninsured in Minnesota. It actually fell to almost right below 5% by 2014, so we're continually doing better. However, you'll see that 19% of American Indian children and 13% of Hispanic or Latino children are uninsured. So that's where our outreach and investment dollars should be going. But right now, and one thing people often ask, American Indian children can access Indian health services, but obviously it's better if they have comprehensive coverage, and those Indian health services can be reimbursed through programs like medical assistance, Minnesota Care, private insurance, and of course that's beneficial. And so this last data point that I'll talk about with the environmental data is the one that really struck me as kind of the most important and critical to be really looking at and paying attention to in Minnesota and across the country. So this is the children living in areas of concentrated poverty. So the concentrated poverty is defined as census tracts, so small segments of neighborhoods that have a population that lives in poverty at a rate of 30% or more. So children who live in these neighborhoods, regardless of their family's economic status, have predictably worse outcomes in life, similar to if they lived in poverty themselves. For those children who do live in poverty in these neighborhoods, their access to opportunities and their predictably worse outcomes are exacerbated by living in these under-resourced neighborhoods that oftentimes have schools that have lower funding and are poorer performing. They're oftentimes less access. They're in food deserts, places where there's not access to health care or social services. Oftentimes there's higher crime rates, and also fewer parks and areas for children to kind of go to be able to have access to different opportunities. So what we're seeing is significant growth in children living in these areas of concentrated poverty. So the number of children in Minnesota living in these neighborhoods has doubled since 2000. And as you can see, children of color and American Indian children are disproportionately living in these neighborhoods. So about a quarter of American Indian children and black children live in neighborhoods of concentrated poverty. And I think that American Indian number is critical to realize concentrated poverty isn't just an urban issue. You know, 3/4 of American Indian children, if you'll remember from my previous slide, live in greater Minnesota. So, you know, these neighborhoods are in greater Minnesota as well. About 1 in 5 of Asian children live in these neighborhoods, 12% of Hispanic or Latino, 9% of white children, 2% of children of 2 or more races. Honestly, I can't explain that anomaly. I haven't figured that out yet. And then 6% of our total child population lives in these neighborhoods. And a lot of what the research is showing is focusing on these neighborhoods is going to be critical to addressing the academic achievement gap, because when you're so under-resourced and you're going to a school that's under-resourced, there isn't a lot of opportunity to succeed. And so you have to kind of surround these communities with supports in order for children to succeed. So I think like the Promise neighborhood, Northside Achievement Zone, those initiatives are going to be critical to addressing some of these issues. And so with that, I'd like to first see if there's any questions on the data presented and then kind of go into our discussion piece. Does anyone have thoughts, comments? Yeah.
I'm wondering, so like when you're talking about the neighborhoods that are identified or certain communities, is that information available to the public? Like to see if
Where the neighborhoods are?
yeah, and then along with that, so if we wanted information specifically about like this region or like specific zip codes, do you guys have that?
So the kids count doesn't have that like on our data center, and we don't do it, we only do it kind of on request. So we have some of it available, and it's harder to disaggregate by race and ethnicity when you get down to those smaller neighborhoods. But if there's something specific you're looking for, I'd be happy to look into it. Here.
Good morning, everyone. Thank you, Stephanie, for giving me a whole 15 minutes. Usually I have 3 minutes, so we're going to be able to be paced. Hello to the millions of people watching us on the website. I'm the senior organizer at Children's Defense Fund. I was brought on, we have amazing policy research people, but to connect the people to the policy work that we do. And so I do a lot of our coalition organizing, our individual leadership in youth organizing, and just building partnerships in early childhood. So advocacy, it's more short term. It's an attempt to influence laws, public policy, and resource allocation. Organizing is more long term, so it's the process of bringing people together to build relationships, identify problems. So it's really deep. Advocacy, you might advocate for a specific issue in the short term for a legislative session, for a meeting with the school district, but organizing is really about building deep, strong relationships. There's several different types of advocacy. Direct advocacy is the lobbying, which is an act of attempting to influence decisions made by the government officials, most often legislators or members of regulatory or administrative agencies. We have a lobbyist that is called the Big Kid. Her name is Jessica Anderson. She's our lobbyist at CDF Minnesota. We also have a policy team that exists with 4 of us that looks at the specific policies that we'll be looking at on a specific session. Indirect advocacy is grassroots or indirect lobbying. It's an approach that separates itself from direct lobbying through the act of asking the public to contact legislators and government officials. So part of this is like the minimum wage, where you're working in coalition and working with others to influence decision makers. And then research advocacy, what Stephanie does at CDF. So this includes our data books and other research that we do to support the policy change that we're seeking. So there's a lot of different ways you can advocate. Building support for an issue, you can educate about a topic, share your own personal experience and stories, and work on a solution to the problem. And the possible audiences that you can advocate with, of course, are public, your faith community, your school and neighborhood that you live in, the place where you work, advocate through the media, through direct conversations with community leaders, and through working with elected officials. Now, organizing, this is the deeper process of engagement. It's bringing people together to build relationships, identify problems, and develop the capacity, the power to change the decisions and processes of institutions that contribute to those problems. And so there's a lot of different strategies within organizing. You can have one-to-one conversations. So these are intentional conversations with other people. Oftentimes we do this as social workers, as teachers. We might not call it organizing, but that's what it is. It's learning about their things and their issues that they care about, and also building that relationship so you can work together at other times. There's leadership development, coalition and network building. And so at CDF, we're part of a few different coalitions. One is the Minnesotans for Paid Family Leave, where we're working for paid family and medical leave in Minnesota. Also the Kids Can't Wait Coalition, which is looking at childcare assistance. And Voices and Choices for Children. And so this is the main thing that I work on at CDF. Voices and Choices for Children is just over a year and a half old. And Peggy Flanagan, our executive director, and Melvin Carter, who's the governor's director of the Children's Cabinet, came together, and oftentimes they were the only people of color in a room, whether it's a boardroom, whether it's at a committee hearing, and it gets draining. And so as early childhood leaders, they wanted to create a space where leaders of color across sectors, elected officials, early childhood professionals, early childhood funders could come and talk about the challenges that they face and that our communities face, especially because of the racial disparity and opportunity gaps that Stephanie talked about earlier. And so this is a coalition that meets about 4 or 5 times per year. We also have a steering committee. But if you're a person of color that's working in the early childhood field, reach out to me. We also have a tab on our website that talks about how to get engaged with that group. We're really excited. We're going to be meeting with the Lieutenant Governor in the Governor's office next Tuesday to push for one of our legislative priorities, which is the Childcare Assistance program. We know on the wait list there's over 7,000 families right now. It's just a little bit over 10,000 kids. And those are the people that are just on the wait list. So many other people don't even try. And we know that kids of color and families of color disproportionately use CCAP and are on that wait list. So it's a racial equity issue. And so our steering committee will be meeting with the governor's office to push that to hopefully get it in the budget before it's released around this time next month. And then there's also voter engagement and education and mobilizing that are used throughout organizing in communities. Education is key to this advocacy work. Direct education can be anything from sending an email or a letter, making a phone call, organizing a forum and inviting people to attend and participate, or face-to-face meetings. Other ways to educate through indirect education is bringing a resolution to your precinct caucus, just continuing a public conversation, sharing information with your communities, writing a letter to the editor, and social media work on Facebook and Twitter. So moving on to our 2016 legislative priorities, we've identified 2 legislative priorities for the 2016 session. We know that a child's success is intertwined with the stability and well-being of his or her family. And so our top 2 priorities at the legislature this year take a 2-generation approach to improving childhood outcomes. So we're looking at affordable, accessible childcare for all Minnesota families and paid family leave for all Minnesota employees. With childcare, it's a 2-generation approach to broader economic security. It allows parents to work, provides children with lasting benefits of improved economic security and a safe, consistent, quality care environment. We know right now childcare is unaffordable. The median annual income for families in Minnesota raising children is $75,300, with the annual cost of childcare at a center is almost $15,000. Which is almost 20% of a family's annual income. When it comes to African American families, the median annual income is just over $30,000, And so that childcare cost is nearly 50% of a family's annual income. And so the program that we're looking at is the Childcare Assistance program. It serves low-income families with children birth to 13 years old, up to 15 years old if you have children with special needs. Covers the cost of care while parents work or are looking for work or while they're in school. More than 60% of the children enrolled in CCAP are children of color, American Indian children. As part of the Kids Can't Wait Coalition, we're also looking at the Minnesota Child Independent Care Tax Credit, and that's a refundable credit for low-income families with out-of-pocket care costs, and we're looking to broaden that tax credit. With CCAP, the state investment in the basic sliding fee has decreased by 44% in 10 years, while the cost of childcare has also increased at the same time. Now it's over 7,000 families on the wait list, and out of those 7,000 families, it's about 1.8 kids per family. And that's just the families on the wait list. So many more don't even bother to apply because of how long it takes. CCAP provider reimbursement rates are eroding. Only about a third of the provider rates are covered in full by reimbursement, so it limits families' choice of providers. The current child independent care tax credit eligibility threshold is $39,000 per year, and so we're looking to increase that to broaden that. And the size of the credit doesn't reflect the rising cost of child care. One child, $720, and two children, just over $1,400. So we're advocating to make child care more affordable and accessible, where the coalition is requesting to fully fund or forecast the basic sliding fee so all eligible families can afford the child care that meets their needs. We're asking to increase CCAP provider reimbursement rates. So right now they're at around the 25th percentile for provider reimbursement rates. The Kids Can't Wait Coalition is asking to increase that to the 50th percentile. The Voices and Choices for Children Coalition is asking to increase that to the 75th percentile. And we're also pushing to improve the state's child independent tax care credit, which we've talked about. Next up is paid family leave. The Children's Defense Fund is a co-chair of this coalition. So we know that few Americans have access to paid family leave. The U.S. is pretty much the only advanced economy in the world that doesn't guarantee paid leave. Only 13% of employees in the U.S. have access to paid family leave through their employers right now. Low-income, part-time, single-parent workers, often from communities of color, are the least likely ones to have access to this leave. Only 60% of employees in the U.S. have access to unpaid leave under FMLA. And so the way that families have lived has changed. Almost 30% of children live in single-parent households now. Almost 3/4 of children have all available parents in the workforce, and many households rely on two incomes to make ends meet. So the way that the request for paid family leave that we're pushing, the policy that we're pushing, is to be done through an insurance plan model with the state. So imagine or think about how we pay into state unemployment. So it would take a year for us to pay into this program, but what it would deal with is it would be state administered. The paid leave would be up to 6 weeks per year. It would be partial wage replacement from 65% to 95%, up to $1,000 per week. And what we've seen in the few other states is that for it to work, it needs to be a progressive model. So kind of the lower income you are, the more of that income that you receive. Pregnancy-related health concerns, parenting, care of seriously ill family members would all be covered by paid family leave and medical leave. And it would be funded through a small payroll premium. So it would be a fee of 0.1% on the first $78,000 of annual income matched by the employee. So the average of this would be around $34 a year for both the employee and the employer. The reasons to do this, of course, are economic. It protects family economic security, retains women's workforce participation, reduces reliance on public assistance, and also health and well-being. It increases time spent home with newborns, increases the breastfeeding rate, improve maternal, mental, and physical health, increases paternal involvement, and improved outcomes for children with special needs. So these will be our two pushes. I think Stephanie passed out CCAP. Did you also send out paid family leave? Yep. So we have 2 postcards that you can sign and hopefully leave behind that we'll be sending to the governor's office. It would be great now. We also have a call to action specifically around CCAP right now in the next week. If you can just make a quick couple-minute phone call to the governor's office and let them know that you support CCAP and fully funding CCAP. This is a critical time right before the governor puts out his budget, and we'll be meeting with the governor's office next week to push him on CCAP. So I'll take any other questions, or and I'll refer you, especially if you are interested in Voices and Choices. It's a new group, it's an emerging group, and if you're a person of color working in early childhood across sectors, please reach out to me. And also, if you're an ally that works a lot with kids of color, you're welcome to attend too. There's a lot of allies in the room, and we can't do this alone. We need friends to help uplift this work. So please feel free to reach out to me, check out the website, and I think we'll take any questions about this or just overall.